Hi, my name is Richard Finn. I'd like to talk to you a little bit today about the Avazzia. This is a small microcurrent device, and the thing I really like about using this is that you can feel it when it's on. A lot of microcurrent devices, you don't feel anything, but this one has a higher voltage, and the voltage is what you feel. And so the idea is, if the brain kind of knows where the sensation is coming from, it knows the area that it needs to work on. That, at least that's how it was explained in the training with this. And I would like to say what I'd like to do with this is I use this to calm down the nerve supply to your upper trapezius muscle or to your sternocleidomastoid muscle. Those are the big things that I like to use it for. Now, the name of the technique is called a vagus D, which means down regulate. The nickname is Little Wings, and the reason for that is that the shoulders tend to pull up one at a time. So the idea is when I put this in the proper area, I hold it and turn it on until the person feels it come on. And when they feel it come on, then I keep taking it up a little bit higher until the shoulder pulls itself up. And then the machine shuts down and then it turns back on. I do this for 8 repetitions on either side. And the idea is your vagus nerve comes through this area and it controls all of your internal organs. It helps to calm down that fight or flight idea, so it kind of down regulates everything. In addition to taking care of the nerve supply, again, for your sternocleidomastoid muscle, which is often said to cause pain in the cheek, around the eye, on the top of the head, and for your upper trapezius muscle, which is said to cause pain up in your temple and sometimes in your jaw, and oftentimes up the side of your neck. So there's a lot of things that this can be very useful for. This is also a foundational therapy for working on things with a temporomandibular joint dysfunction. For that kind of thing, I would be holding this here and up through here while I worked. So again, it's very useful for a number of things. I'd like to just demonstrate what that looks like on myself right now. So I'm going to locate my muscle and put this right behind in the back here. And then I'm going to take the machine and I'm going to turn the button on the side, and I'm already feeling it, and it's just barely been turned on. So I'm going to take it up a little bit higher now until it starts to pull my shoulder up. Let's see, here we go. So here we go. We're going to crank it up. Okay, there goes my shoulder. There I go. So that's number 2, 3, and again, I find this to be rather comfortable. People get a little freaked out sometimes by seeing the shoulder come up and down. That's number 4. And again, because it's not something under voluntary control, but again, I feel it where it's at, and I can feel the sensation kind of coming up over my ear. And so that's exactly where I would like it to be. So again, this is going to help to calm down the neck and shoulders. And if I'm in fight or flight, it wouldn't be a bad thing to take care of that. Now, I'm going to switch this to the other side, but before I do that, what I do is I always turn it off and start all over again, because some people can take more on one side than the other, and I don't want to do anything where a person's going to feel like it just grabs them out of nowhere. So I start all over when I do it the second time. So here we go. Let me set it just where I would like it to be. There's a lot of settings on this machine for different conditions and things that I might want to treat. Okay, there it is. Now I'm going to start taking this up until I feel it. And now I feel it, and it took me longer to feel it than it did on the other side. Now we're going to take it up until it starts to pull me, and there I go. So again, that's number 1, and again, it's not crazy on me right now. But again, different people, some people go up a lot higher. There we go, that's number 3. And 4. And here comes 5. Now I can also use this on the back, the legs, the arms, pretty much anywhere on the body. So it has a lot of different uses. I'm just illustrating this one particular technique. But again, if this is something, if you've got a problem with neck and shoulder pain, this is something that would be a really good thing to perhaps try. Again, it's called the Avazzia, and I do this here at the pain spot in Penn Hills. There are other people that do this kind of work, and you can look those people up in wherever your state or location may possibly be. But it's a really good thing. Again, if you're walking around with your shoulders up like this all the time, you might want to try something like this. Thank you very much. I look forward to doing this some other time and showing you other uses for the Avazzia machine. Thank you.